What if your child is not lazy, distracted, clumsy, or bad at reading? What if they simply cannot see clearly? Let me be clear. Kids do not always tell you their vision is blurry. Sometimes they just fall behind, and adults blame behavior before checking the eyes. This is not another soft video saying, maybe get an eye exam someday. Here's the truth. Pediatric ophthalmology is not cosmetic. It is not just glasses. It is not only for children who bump into walls. It is medical eye care for kids. A child may have eye crossing, lazy eye, unequal vision, droopy eyelid, blocked tear duct, eye inflammation, high myopia, congenital cataract, or rare but serious problems hiding behind a normal-looking face. Nobody tells you this. Children often adapt to bad vision. They move closer, they tilt their head. They avoid reading, they cover one eye, they melt down over homework. Then someone says, they are not trying. Maybe they are trying harder than everyone in the room. Picture this, a 6-year-old hates reading. Every worksheet turns into a fight. The teacher says they lose focus. At home they sit too close to the television, they rub their eyes. They complain of headaches. The parent thinks, maybe attention issues, maybe too much screen time. Maybe sugar, maybe discipline. Then one day, someone notices the child closes one eye when looking at a tablet. That is not random. One sign can be easy to dismiss. Several signs form a pattern, and here is the uncomfortable part. Adults ask children to perform before checking whether the child can actually see the task. We would not ask a kid to run with one shoe missing. But we ask them to read, write, track, copy, and focus with vision. Nobody has properly tested. That is not fair. Pediatric ophthalmology focuses on eye and vision problems in babies, children, and teens. Some problems are simple. A child may need glasses, others need treatment fast because the brain is still learning how to use the eyes. Amblyopia, often called lazy eye, happens when vision does not develop properly in one or both eyes. The eye may look normal, but the brain may rely more on the stronger eye. Strabismus means the eyes are not aligned correctly. One eye may turn in, out, up, or down. Refractive errors, like nearsightedness, farsightedness, or astigmatism, can blur schoolwork and screens. And some warning signs are not wait-and-see problems. A white pupil in a photo, sudden vision change, eye pain, severe redness, trauma, or a new eye turn deserves medical attention. Why do kids have these problems? Sometimes the eye shape causes blurry focus. Sometimes one eye sees better than the other. Sometimes the eye muscles do not line up properly. Sometimes the eyelid blocks vision. Sometimes a medical condition affects the eye. And sometimes, yes, blood sugar problems can blur vision. But do not turn every eye complaint into a diabetes panic. That is internet theater. Let me be clear, screens can strain eyes, but screens are not the only villain. The bigger danger is delay. A child's visual system develops over time. If one eye is ignored by the brain for too long, vision can become harder to recover. That is why early screening and exams matter. Not because parents should panic, because time matters. Stop waiting for your child to say, "Mom, Dad, my visual acuity is reduced." That sentence is never coming. Kids do not talk like eye charts. They say, "I hate reading." They say, "My head hurts." They avoid puzzles, they skip lines. They lose their place, they squint. They cover one eye. They tilt their head. They get cranky after school. Here's the truth, behavior can be the symptom. Not always, but often enough that ignoring the eyes is lazy medicine. If the story keeps repeating, do not just punish the behavior, check the system. So what should parents actually do? First, watch the pattern. Squinting, head tilting, sitting too close, eye rubbing, headaches, reading avoidance, poor hand-eye coordination, or one eye drifting. Second, take failed vision screening seriously. A school screening is not a full eye exam, it is a filter. If your child fails, follow up. Third, know the red flags. White pupil reflection, sudden vision loss, eye pain, severe redness, light sensitivity, eye injury, new eye crossing, droopy eyelid blocking the pupil. These are not ask Facebook moments. Fourth, ask for the right referral. A pediatric ophthalmologist is a medical doctor trained in children's eye disease and surgery. An optometrist can also provide important vision care and glasses. The right professional depends on the problem. Fifth, do not shame glasses, patching, drops, or treatment. Kids take emotional cues from adults. If you act like treatment is a punishment, they will too. Now here is the part that makes parents angry. Some eye problems are silent. A child can pass through daily life using one stronger eye while the weaker eye falls behind. They may not complain because they do not know what normal vision feels like. Samey classroom, samey board. Samey book, different visual world. That is why pediatric eye care is not just about can they read tiny letters. It is about alignment, focusing, eye health, depth perception, visual development, and whether both eyes are working together. And no, buying random blue light glasses online is not a pediatric eye plan. That is a product, not a diagnosis. Reality check, delayed eye care can cost more than an appointment. It can cost confidence, reading progress, sports participation, classroom behavior, and sometimes, vision itself, but panic is not useful either. Not every headache is an eye disease. Not every child who hates homework needs an emergency appointment. The middle path is calm urgency. If symptoms are persistent, worsening, one-sided, or affecting school and daily life, get evaluated. And please stop using comment sections as a clinic. No eye exercises from strangers, no miracle drops. No detox for vision. No ignoring a white pupil because someone online said it is just camera flash. Let me be clear, a child's eyes are not a trend. They are still developing, treat them like they matter. Here is the hopeful reframe, an eye exam is not a label, it is a light switch. It can explain why a child avoids reading, why one eye drifts, why homework turns into war, why sports feel harder than they should. Maybe the answer is glasses. Maybe patching, maybe drops. Maybe surgery, maybe monitoring, maybe reassurance. But information beats guessing. And parents do not need to become eye doctors. They need to become pattern reporters. Notice, document. Ask, follow up. If your child needs glasses, make them normal. If they need patching, make it brave. If they need a specialist, do not treat it like failure. You are advocating before the window gets smaller. This video is for education only. It does not diagnose, treat, or replace advice from your child's pediatrician, optometrist, ophthalmologist, pediatric ophthalmologist, or emergency clinician. Seek urgent care for eye trauma, sudden vision loss, severe eye pain, a white pupil reflex, severe redness with light sensitivity, or any emergency symptoms. If you want clear health content without sugarcoating, subscribe. Leave a comment with your questions or suggestions. Tell us if you want a video on lazy eye, crossed eyes, kids' glasses, eye drops, diabetes and vision, or warning signs in baby photos. And watch the next video, because we are breaking down what parents should know about pediatric chiropractic care. Common warning signs, and when it is time to talk to a qualified healthcare professional.